Adjustable Trans-Obturator Male System atoms has demonstrated effectiveness for the treatment of post-prostatectomy urinary incontinence both in multicentric studies and meta-analysis. In males, the treatment of post-prostatectomy urinary incontinence is based mainly on artificial urinary sphincter implantation. This device can be inactivated to allow the patient to void. However, unlike artificial sphincter, there is no possibility to disable the atom device. Consequently, the increase in urethral pressure is maintained throughout the voiding phase. Studies performed in females after surgery have shown an increase in urethral resistance that leads to bladder outlet obstruction in a non-negligible number of patients. Our purpose is to assess the changes in the voiding phase after atom implantation in male patients with post-prostatectomy urinary incontinence. We carried out a prospective longitudinal study between October 2020 and March 2021. The inclusion criteria were patients with a previous urodynamic study before atoms implant and informed consent to be included in the study. The exclusion criteria were presence of bladder outlet obstruction due to bladder neck contracture or urethral structure proved by urethroscopy and patients who underwent urinary tract surgery between preoperative and postoperative urodynamics, such as transurethral resection or bladder tumor or urethroscopy. The initial sample size was 54 cases, age 70 years, plus minus 5.5 years. The final sample was 45 cases, age 70 years, plus minus 6.5 years. The causes of exclusion were death in 3 cases, absence of consent in 22 cases, urethral stenosis or bladder neck contracture in 6 cases, impossibility of catheterism in 2 cases, and psychogenic inhibition in 1 case. Patients were submitted to a pressure flow study by means of a polygraph U2000 according to the specification of the International Continence Society and the Protocol of Good Urodynamic Practice. The diagnosis of bladder outlet obstruction was made when the URA value was equal or greater than 29 centimeters of water. We observed a statistically significant difference in maximum flow rate greater before surgery. However, the post-void residual urine did not vary significantly. The bladder outlet obstruction index augmented significantly after surgery, and bladder contractility index diminishes significantly after surgery. However, the URA index did not have statistical difference before and after surgery. We found that 2 patients had bladder outlet obstruction perioperatively versus none post-operatively. No significant difference. As conclusion, we can say that the atoms implantation in male patients with post-prostatectomy urinary incontinence results in an increase of urethral resistance without any case of bladder outlet obstruction and a decrease in bladder contractility, and that these findings suggest that these changes may reflect a return to a more physiological voiding condition.